I just would like to share some results that we achieved at the Hospice in the University of Padua and azienda ospedaliera in Padua in collaboration with Roberto, the Professor Franca Benini, and also Valentina De Tomasi. Well, the purpose is to use this humanoid robot in order to improve the children's state during the therapy. So it's like a non-pharmacological techniques, like the bubble, like the puppies. And the idea is to guarantee the best social emotional support. But at the same time, if the children are more relaxed, we can also improve the collaboration between the patients and the staff. So we create something that is very inclusive, since we can, for instance, talk in different languages. And at the end, the result is to facilitate the clinical procedure. But keep in mind that the robot is still a support. So we want something that is not an obstacle for the clinical staff. And so in the 2018-2019, we, despite different barriers from the bureaucratic point of view, we were able to introduce this humanoid robot also with the collaboration, the Cariparo funding, the Pepper robot and the Sabot inside the hospitalization before the selection and the anesthesia. So the interaction with the children was like a spotlight, so very fast interaction. But what we are interested in is to investigate the emotional condition of the patients, of these children, before, during, and after the procedure. Not only we focus on the feelings, but we focus also on these different robots. It was not so important, the technical aspect. Well, there are some differences in terms of technical functionality of this robot, because, for instance, Pepper is very nice, is able to reproduce the human emotion in a complex way, and also change the tones of the voice. While instead Sambot is more simple, is able to reproduce very basic movement, but is, with respect to the Pepper, is able to customize the interaction, also reproducing some expression in the display, so sharing the feeling with the child. But this was not the focus. The focus is still on the interaction, as also Roberto explained. So we are interested in the feelings of the patients that interact with two different robots, and also the acceptability, because what is important is also to acquire some feedback, for instance, from the parents of the children. Well, the protocol in this year was very basic, because also there are some barriers in the ethical committee, because we cannot include some advanced behavior in this robot. So after the proper documents, so after the patient's parent that agreed to participate in the study, then the robot was assigned to the child. Actually, it was not a surprise, because we familiarized with the child, that we inform about the robot to a picture that is going to meet in the procedure room, and then the intervention started. The intervention was in this procedure room, where the child just see the robot, so cannot interact physically with the robot. And the robot was controlled by an operator. And this is another barrier that we have in our experiment. And the parents also assist to this procedure. What about the experiment? Well, the robot starts to introduce itself, and the purpose is to create a bond with the child. Ask some question, show some animation, and also try to relax the child. And finally, we collect the feedback. we were able to do this experiment with a different range of patients, and this was very good because we just learned that it's possible to have different interaction based on the age. In fact, for instance, the child that are preschool age prefer to interact with a sambot because probably is smaller, so more similar to their friends. Rather, the teenager and the school age children prefer to interact with Pepper that is able to reproduce and to move in a more complex way. But this is not important. What is important is that we achieve a significant reduction of the negative moods and also an increase of the positive feelings. And this from both the robots, and we observe also some difference. For instance, Pepper stimulate more the want to joke, while instead, for instance, Sambot was very helpful to reduce the anxiety and the fear of our children. And what about the acceptability? The acceptability say that the parents was happy about this kind of therapy, that in both the case, in both with Pepper and the Sambot, and also evaluate that this was very helpful for the children. Not only, also the children confirm this, because say, I think that Sambot loved me. To play with Pepper made me not think about the gastroscopy. I want to bring home Sambot, but I wanted to highlight that some children say very tender doctors. So we don't want to substitute the rule of the doctors. The robot is known as just a support and is a complementary tool in order to engage the children during this therapy. Despite you see that this is very simple experiment, actually we learn a lot from this kind of experience with the robot, even if there are no robot autonomy and intelligence, because we saw how difficult it is still to introduce these devices inside the clinical aspect, and also how children expect a lot from this device, okay? And at the same time, so we don't allow to create some failures during the procedure. So what is the fact? The fact is that we need to have some figures, some operators that are able to interact with the robot and then answer, for instance, in time to the question of children. But this is not sustainable because, first of all, we need to train the operators. And then this is very difficult because clinical staff have a lot of duties to do. So this is a gap that is still there, and we need, and many AI can help in this direction. In this year, actually, I work a lot with Pepper and also investigating which is the expectation, the perception of this kind of robot. For instance, since this robot is considered like neutral, I ask, but maybe we need to attribute a sex to this robot when we interact with these devices. And I collaborate with some psychologists in order to know some feedback about the population, also to verify if there are some stereotypes. And I see that actually most of people, both male and female, consider Pepper as a male, not a neutral figure, and also consider this device very good for the communication. So I think this is very the main point of this robot, and maybe the reason why the chatbots are very common. Then in the next year with Roberto, we start actually create more inclusive pediatric robot by considering also the children that cannot move or cannot communicate in a traditional way. And so we use these device, the brain-computer interface, in order to acquire the data related to the intention of the user directly from the brain and convert then into a command for a robot. But the problem with these technologies is that they are very noisy, and with this kind of interface, the child can communicate only few commands. And so in this kind of scenario, it's the robot that has to adapt to the context. And so what I proposed during my PhD is to create a sort of shared intelligence. So it's the interaction between the child and the robot that can enhance the interaction on the environment and in order to reach a specific goal. For this reason, for instance, the robot can help to avoid some obstacle or help the child to reach a specific goal. Actually, in this case, we test only in a more controlled scenario, but the idea is to, in the future, hopefully when the ethical and the regulation gaps are filled, we can try also in a more realistic context. And what about the current direction? As I mentioned, and also as Roberto talked about, we want also to create a sort of intelligent robot. So the AI is like, the robot is like the embodiment for the AI in order to create a more immersive experience, but also more emotional and also empathic interaction. It's true that AI can help a lot, but we need to consider also the sustainability. So at the moment, we are focused on more and less expensive platforms with respect to Pepper and Sambot that are Omni, first of all, and then Aiello, that actually is the first robot in Italy, thanks to Matteo Suzzi. And but we need to consider also the cost of the AI. I found this, for instance, a survey that compare the use of a chatbot, so the use of these token produced by services that is comparable, for instance, to the two hot baths. And we don't forget the use of water that are used for get cooling this server and all the stuff. And so for this reason,
Gloria, 2 minutes, please.
Yes,
thank you.
Sorry. And so we are trying to customize this Helio, considering like a very lightweight model without complex AI to tell story, make a rider, sing a song, and so on, and also acquiring some emotion feedback from both the text with sentiment analysis and also with emotion recognition based on lightweight model. So, well, social assisted robots are very powerful for inclusion opportunity, especially in the pediatric context. I think we need a cross-disciplinary research as in this community is doing. And also there are still different challenges, including the regulation, the resource, the cost, but first of all, I think the technology awareness. So in order to be acceptable, we need to know how this technology is working. So thank you very much for your attention, and again to Roberto and all the organizers.